My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
I guess this kind of tags on to the prior question. So my question's about probiotics, and curious why the data shows they might be helpful with ulcerative colitis, but not so much with Crohn's.
Mm-hmm. Yeah, that's a good question. And it may have something to do with kind of the underlying differences between between Crohn's disease and ulcerative colitis. I think taking a step back, it's important to understand what probiotics are and prebiotics, for that matter. It's a term that's increasingly more commonly used in media. So probiotics are the actual, bacteria that you're consuming, usually in pill form, that are going into your gut, your GI system, and thinking is that it would potentially alter your gut microbiome in such a way that it's more positive, reduces inflammation, and cures a variety of different ailments. Prebiotics refers to the different sugars or the different nutrients that you're using to feed the bacteria that's already in your gut. So prebiotics are basically your diet, what you're eating, because as you consume different types of sugars, different types of nutrients, you're going to preferentially influence the growth of different types of bacterial communities over others. And so there's this complex interplay between prebiotics and your natural microbiome and how that affects how your body uses nutrients or absorbs nutrients, as well as the gut's own immune system. But we just don't have great evidence to show that or to recommend one pathway or another. So what do we use probiotics for in general? I use it frequently for my patients who have pouchitis, for example, so inflammation of the pouch, of the J pouch. There have been studies that show that certain types of probiotics can prevent a recurrence of the pouchitis after you've treated the initial event with antibiotics. In ulcerative colitis, probiotics in general are just pretty understudied. The existing studies have relatively few patients, so you kind of have to take the studies with a grain of salt. That doesn't mean that it doesn't have a benefit. It doesn't mean that there is a benefit. It just means that we really don't know yet. I think there was a 2009 study that showed that VSL number 3, which is a probiotic you can get over the counter, can help induce clinical remission in mild, moderate UC cases compared to taking placebo pills in UC patients. But again, we just need more studies with more patients. In Crohn's disease, probiotics really have a mixed effect. It's really unclear why. It could be because of how these studies were designed. It could be drug-related. It could be the probiotics really truly have an effect. It could be because, Crohn's disease, because it's very different biologically from ulcerative colitis, that's why it doesn't respond to probiotics as well. We really don't know. But so far we know that kind of the aggregate of the evidence out there with regard to probiotics and Crohn's disease is that it really doesn't support clinical effectiveness of probiotic therapy. So at the end of the day, I probably use probiotics more frequently in my pouchitis patients than my UC Crohn's disease, typical UC or Crohn's disease patients. And hopefully with time we'll know a little bit more about which probiotics to use under what situations.